Rotator cuff muscles include supraspinatus, infraspinatus, and teres minor attaching on the greater tuberosity of the humerus and subscapularis attaching on the lesser tuberosity of the humerus. Tears most commonly occur in the supraspinatus muscle in rotator cuff. Common causes of rotator cuff tear include injury, overuse, and aging. Supraspinatus is involved in initiation of abduction of the arm, while infraspinatus and teres minor causes external rotation. Subscapularis is involved in internal rotation. Partial tear of supraspinatus causes difficulty in initiation of abduction, while complete tear can cause a positive drop arm sign. Our patient came with pain around the shoulder joint, difficulty in lifting the arm and crossing the arm, and also difficulty in overhead lifting of the arm. Let's see the ultrasound image of this patient. Starting anteriorly in the short axis, the greater lesser tuberosity are identified. The biceps tendon is seen between the tuberosities, and here we can see the tendon is inflamed and there's a lot of fluid surrounding the biceps tendon. The transhumeral ligament is also seen to be lifted up. The probe is then gradually rotated over the biceps tendon to examine it completely. There was no tear in the biceps tendon. However, even in the long axis, the biceps tendon appeared inflamed. This is the long axis of the biceps tendon. The probe is further moved to see the muscle bulk. We can see fluid in between the muscle fibrils indicative of inflammation in the biceps muscle as well. We then scan to identify the individual muscles of the rotator cuff. Here again we come to the tuberosities, and the probe is turned longitudinally over the greater tuberosity to see the attachments over it. We know the supraspinatus is attached on the greater tuberosity cranially and the infraspinatus is attached caudally, like seen in the picture on the right. In the ultrasound image, the craniocaudate orientation is from the left to right. On the screen, muscle on the left is supraspinatus and on the right is infraspinatus. Supraspinatus tendinopathy is when the pathology occurs anywhere over the tendon, while enthesopathy is when it occurs at the point of attachment over the bone. We can see a tear in the supraspinatus muscle. The arrow points towards the hypoechoic region, indicating fraying of muscle. We can see some inflammatory changes in the infraspinatus muscle as well. However, there was no tear. Subscapularis is a multipinnate muscle. Its origin is from the subscapular fossa and inserts at the lesser tuberosity of humerus. It is involved in the internal rotation of arm. Hence, active external rotation relaxes the muscle and can be examined in that position. Here, the patient is asked to keep the arm adducted and move the elbow outwards, resulting in external rotation of the arm. We can see the subscapularis, which is a multipinnate muscle, and there is some inflammatory changes in the subscapularis muscle as well. When the probe is moved further medially and cranially, we can identify the acromion process of the scapula, and it is an important landmark to identify the subacromion subdeltoid bursa. This can be inflamed in conditions like rotator cuff tear. Shoulder joint injections can also be done here, and injection of steroid or PRP in the subacromial subdeltoid bursa can also help in the treatment of rotator cuff injury and pain. In the next video, we'll see about the management of this patient with supraspinatus tear and shoulder pain. Thank you for watching.